I had a chance today to talk a little bit about a comprehensive primary care model delivered in the patient's home. I think if you were looking for a key takeaway, it's that primary care doctors have never been limited by sex, by age, or by disease state. But I think in the future we're no longer going to be limited by even the physical location of our offices, that we are going to reach out to patients virtually as well as personally for our most chronic and complex patients in their own homes. VillageMD, we work with primary care doctors to help them be successful not just in today's fee-for-service environment, but to move and prepare for the value-based reimbursement that I think we all believe is coming. Even in the most complex patients that we work with, the kinds of patients that we do provide comprehensive primary care in the home, we actually work in a risk model. In other words, we're willing to kind of put our money where our mouth is. And if we can't deliver a different clinical outcome and a different economic outcome, even for the most complex of our patients, we shouldn't be paid, and we're willing to do that work. People talk a lot about the movement to risk. I actually think the movement to risk is really just reimbursing physicians the value they deserve for the value that they actually create. So what we're seeing is recognition of those doctors who can manage chronic and complex care across all ages, sex, and disease states. And we're seeing reimbursement models that are lining up with it. So I think we've been talking about value for a long time. What that really means is just paying the right doctors the right amount to do the right kind of work. And it feels like we're getting closer to that inflection point where we'll start to see some of the results of those changing economic models. A lot of talk, interesting talk about telehealth. As a primary care provider, we are always interested in continuous and comprehensive primary care services. So lots of talk about where telehealth is going to fit in our environment. I believe telehealth is actually a platform for primary care doctors to reach out and to contact their patients, not actually a provider for another set or area of possible fragmentation. So looking forward to an evolution in telehealth where we truly see it as an extension of a patient's primary care doctor and not necessarily a new primary care point of contact. Yeah, absolutely. It's been a lot of fun. It's a great hotel. Washington is always a great city to visit, and you certainly have been a great host. So seeing lots of people, lots of energy, looking to get involved and be back again next year.
Awesome.
Awesome.
Thank you.
Thank you very much.